Good morning, good afternoon, members of the air quality practice community. I welcome you to the fourth and final Tech Talk. I'm Sandra Meneses, Air Quality Coordinator at WRI Colombia. Hello from Bogota. So we have our deep breathing, Respira Profundo event right now, and people are here connected virtually. Next. All right, then. We're going to go ahead and get started with the final session. Today's session is titled Communicating the Risks of Air Pollution to the Public Through the Use of Air Quality Forecasts. The goal is to discuss the use of air quality forecasts for developing alerts and warning systems and efficient communication about health risks, both to the general population as to decision makers in the healthcare sector, as well as sharing experiences about different strategies and communication and diffusion of air quality forecasts. We will have Dr. Patricia Segura first. She's the head of the Bronchial Hyperreactivity Research Department at the National Institute of Respiratory Diseases in Mexico. She will talk about the case study of the risk index for susceptible persons in Mexico City. Go ahead, Dr. Patricia. Thank you very much. Thank you. First of all, I would like to thank the organizers. Thank you for the invitation. And well, I was listening to the panelists at the start of the meeting, and what caught my attention was this lack of a link between the healthcare sector and air quality, the air quality sector, which includes measuring government authorities who have to review all of this. And well, this is interesting because the lack of a link between these two sectors in the end affects the population, the people who are breathing in these pollutants. And yeah, I understand that the case of Colombia is remarkable in many ways, but I would like to emphasize the case of Mexico City and what Mexico City has done. I've had the opportunity to work with Betty Cardenas some years ago, and I think it's really important to highlight how this multidisciplinary work, multi-institutional work is crucial when we think not just about improving the quality of the air that we breathe, but on how this can have an impact in the healthcare sector, improving the people's health and trying to prevent future adverse effects on health. And there's no effects of pollutants on health if there's no exposure. So we need to think all the time about preventing exposure. In the 50s, in the 60s, last century, last millennium, right? Mexico City was known as the most transparent region. It's a beautiful place, but if you can go to the next slide, unfortunately, the exponential growth of our city and the weather conditions of the city, the geological conditions of the city mean that this valley has a high degree of pollutants. There's a huge concentration here. Unfortunately, in 1990, the WHO declared Mexico as the most polluted city on the planet. But I'd also like to emphasize that starting in 1990, we started a series of very important programs to improve the quality of the air in the city, which has in fact improved. However, we still face some serious problems in terms of pollutants and their effects on health. Next one. So, from the healthcare sector, there's this concept that is impossible to ignore now when we talk about the development of diseases. We call this the exposoma, when the chemistry of the environment interacts with our biology. That's what this is about. And from the moment of our conception, we are in contact with chemical substances. First, through our mother, and then throughout our lives until we die, we're going to be in contact in general with chemical substances that come from the environment. This is important because being exposed to these substances will determine our biological. Chemical substances trigger epigenetic changes, that is, they modify our genetic response. It changes our metabolic capabilities. Toxic chemicals can generate oxidation, and we are the world to many other living beings. That's very important. We host millions of bacteria which contribute to our health, and they are also the victims of these pollutants. And that is why it's hugely important to understand the effect that these substances have on our health. And it's also worth noting that there's going to be periods in our life where we will be more susceptible to this exposure. Next one. And in this regard, there's a lot of diseases that we now understand are directly linked to, to this issue, either their onset or their evolution, right? I'm talking about pollutants that we find in the air that we breathe. We breathe complex mixtures. It's not like we're only breathing ozone right now or particulate matter. No, every time we inhale, there's a mixture of different pollutants, which is very important. It's also worthwhile, as I was saying, to note that these mixtures and how they are formed will determine the potential damage to our health. And the size of these pollutants will also affect how they are absorbed, to where in our body they get to. So there's different systems in our body that will be affected in different ways, and these pollutants will affect them. Next slide. All right, and something that I find tremendously important and that we need to understand is that while air pollution is democratic, that is, everybody breathes the same air, not everybody will respond in the same way. So we will find vulnerable populations or susceptible populations because of their physiology. Very young kids, seniors, they are unable to face these environmental aggressors in the same way as a young person. And pregnant people, of course, not just because of themselves, but because of the child that they're bearing. These are susceptible populations. And this also includes people who already have an illness. They will be much more susceptible. And it's important to understand that there's other sectors of the population that will face a lot more exposure to these pollutants, like people who work outdoors, like a food delivery person, and also employers who, besides breathing in the environment, at their places of work, they are also exposed to these environmental aggressors. So this idea about thinking of the effects of these pollutants on our health is going to shift, right? From this paradigm of thinking that everything is acute effects to thinking that they will affect everybody differently. And it's worthwhile to think about how everything that we study about these pollutants and on their effects on our health is based on acute events. And it's very hard to distinguish cause and effect. I go outside, I have a headache, I have a runny nose, but this chronic exposure will trigger different illnesses like cancer, neurodegenerative conditions. And it's important to know that there's chronic illnesses associated with these pollutants, but every day There's other conditions, neurodivergence, for example, things that affect our endocrinological system, the metabolic system, and so on. And as I was saying, it's also very important to consider that these complex mixtures, which are not just in particulate matter, but also in the gas phases, when they combine, they will increase in toxicity. There's a synergy. A classic example are allergies. We find the allergens like pollen, but when we breathe them together with, say, diesel particles, they trigger the immune system and they generate allergies in people who didn't have allergies before. So it's essential to understand how each pollutant, when it comes into contact with the respiratory system and with each of our organs, like the brain, the liver, will trigger a different cellular or molecular response. And these will modify in turn the immune system. And if I have a certain profile, because I had cancer or because I suffered from a metabolic illness, then my response will be different. This is why it's hugely important to think about how we don't just have to measure the presence of pollutants, but we also have to notify the population about the presence of these pollutants. We need inventories. We need to measure the problems or else we can't see them. And we need to highlight them. Because we don't just need to give people the right to clean air, but also the right to information so that they can make informed decisions on whether they want to be exposed to these pollutants or not. So one thing that is hugely important is to be able to predict based on the inventory data so that if we know the given environmental conditions, if we have data from last year, then I can predict and tell people this is going to be the air quality for this date. And these are the measures that you should consider for protection. And well, in this regard, it's very important to keep in mind that our goal is not just to improve air quality, but also improve how we communicate information on health risks to the population. I'd like to talk about the work that we did with the Secretariat of the Environment in Mexico City and with Betty, because we generated an air quality index, which is aimed at vulnerable populations. The benefit of this index is that it has a forecast. It's multi-pollutant, it's individualized, this forecast, and this index was based on mobility data for Mexico City. Morbidity, sorry. And this is an index for susceptible or vulnerable populations, which was generated based on 6 years of work, of studying, of data on air quality. And it's a multi-pollutant model. It's very important to note that this project, well, it was carried out between 2010 and 2015 in collaboration with the SEDEMA and the Mexico City Secretariat of Health. At 40 health centers, there were primary diagnoses followed that were monitored, right, of people who came in because they had acute respiratory illnesses, they had asthma, bronchitis, and the age groups that we studied included minors and adults as well. And all of these results were compared with the air quality throughout all of these years, as well as with meteorological information. So we reviewed and associated more than 600,000 visits to the emergency room so that we could have clear links, or that we could try to have very clear links within 3 days of the presence of pollutant. We used algorithms to look at the weight of each different pollutant in the presence of these aggravation of the illnesses, right? So that we could figure out which pollutants were more associated right? We looked at the peaks for these acute pollutants and how that was associated or correlated with visits to the ER. It was determined that there were 3 pollutants that were directly associated, and their combination was associated. It was ozone, PM2.5, and nitrous dioxide. Based on this, we did matrices to determine the scales of these pollutants. Like went from nitrogen dioxide, to 0, which is no presence of this combination of pollutants, to 10 or even over 10, which is a very high concentration. So the low levels are quite below what the WHO allows, their combination, but if we go to 4, 5, and 6, that means that at least one of the pollutants is above the WHO recommended levels, but at permissible levels still, based on Mexico City regulations. And then 7, 8, 9, 10, and above, that means that the 3 of them, or at least 2 of the pollutants, are above Mexico City regulation levels. This program is called Check Your Number, and this is how we show that to the population so that they can understand the presence of acute events, and they can determine, based on this combination of pollutants, what their symptoms may be, and they can be aware of this. We validate this information with patients of the National Institute of Respiratory Illnesses. We have 3 cohorts: children with asthma, adults with asthma, and seniors with COPD related to tobacco use. You have 2 minutes left, doctor. Okay, so every day our cohorts filled out validated surveys that looked at their symptoms, their exposure to the pollutants, in such a way that the CAT and the ACT, which are the surveys to monitor the symptoms for asthma and COPD, would help us measure the exposure. They would have to be outdoors for at least half an hour, right? So what were the symptoms that they had that day? And we found a direct correlation between the symptoms that the patients exhibited and the number that they identified according to their sensitivity. So we managed to establish this correlation in the patients between the air quality index with the symptoms that they showed. Next one. And of the things that we managed to observe in terms of the numbers and the symptoms, we realize that this is highly individualized. There's people who, with very low concentrations of pollutants, already exhibit symptoms, and some have a greater resistance in terms of exhibiting symptoms. And so there was eye irritation, dry nose, dyspnea, a difficulty breathing, coughing. These were the most related to our risk index for vulnerable people. So what we were able to determine is that this air quality index for susceptible people, this number that people can determine and its application, can be used so that in a much more personalized way, they can know what is their susceptibility to the pollutants. There was an application carried out, the urban application of air risk, or aura, and the intention of this application is for people to sign up for it and specify some data so that we can tell how sensitive they are to the pollutants. And aura has these advantages: that it's individualized, it's a forecast, it's multi-pollutant, and this also has the advantage that yes, we have this personalized air quality index, but also it has information on data for pollen and the concentration of pollen in the air. And it's worth mentioning that this will now be able to be applied to the air quality application in Mexico, the existing app. The idea is to make it a lot more interactive. The idea is to get data from the population about their signs and symptoms so that we can have very large databases and look at the sensitivity of the population of Mexico City to these pollutants. Of course, the goal is for this information to be available for those who need it. It will send warning messages when there's important spikes in the concentration of these pollutants. And then finally, next one, I'd like to emphasize how grateful I am to these people because this work has been possible thanks to a lot of institutions like the National Institute of Respiratory Illnesses, the Atmospheric Science and Climate Change Institute, the Technologic Institute of Monterey, and other institutions. We've been working hard together to think about what's most important, which is to prevent adverse effects for the population of Mexico City. And that's it from me. Thank you very much. Thank you very much, Dr. Patricia. Now we will have a, a roundtable discussion. Dr. Cardenas will help us moderate. So please, you have the floor.
Sí, la presentación que acabo de
Súper bien.
No, parece no hay preguntas.
Me titulé muy bien mi charla. Yo bien.
There don't appear to be any questions. So I'll give the floor to Dr. Beatriz to start with the roundtable discussion. Thank you very much, Dr. Patricia Segura. That was a fascinating presentation, and there's always something new to learn. So thank you. So we are broadcasting from Bogota right now. Our colleagues here in Colombia have been very generous in hosting the practice community, and we have a panel today. This panel will have the participation of experts. Dr. Patricia Segura mentioned the link, the relationship between healthcare experts and environmental experts. And this work needs to be done in tandem. So I will present the speakers now. We have Edison Ortiz, who represents Daniela Garcia, Deputy Director of Air Quality from the Secretariat of Environment of Bogota. Thank you very much. We also have Nick de Jesus Peñalosa, Supervisor of the Forecast Models of the Aburrá Valley Metropolitan Area in Medellin. We have Margarita del Pilar Castillo. She is the coordinator of the Air Quality Monitoring System of Barranquilla. And we have John Cairo Abella. He's a healthcare expert by the Healthcare Secretariat. Okay. So after the presentation of Dr. Segura, and given that we had an event yesterday, in fact, hosted by the Javeriana University and by WRI, we talked a lot about the forecast. We discussed these tools. And as Dr. Segura said, before starting, we were listening to the experience in Mexico City. Patricia Segura talked about this. So there's a very close collaboration between the district secretariat of the environment and the one of health in Bogota. They're very closely linked and they work together to notify the population via forecasts and other tools. So I'd like to ask John, if you could share your perspective in the healthcare sector. What has this process been like? And then Edison. Edison is responsible for the models and the inventories. Go ahead. Well, first of all, thank you very much for the invitation. So first for our country and then for the city, it's important to talk about these issues. First of all, there needs to be a direct relationship between sectors in terms of technical issues, academic topics as well, and as Dr. Segura mentioned, in how that impacts people's health. So the question that we need to ask ourselves is, why do we measure? What's our goal in measuring? Why do we measure? Well, for how that affects people's health. So there's a direct link between emissions, exposure, and effects on people's health. That is why we need the synergy. We need to work together in the technical side of things, which is the measurement, as the doctor mentioned. If we don't diagnose a problem, it doesn't exist. We need to make it clear. So we have air quality, and of course, it changes depending on the location. And we also have the meteorological conditions affecting air quality, and which has a direct effect on people and their health. I'm not going to delve into the details about the effects and so on. This has been described before. But we need to work together. What do we do with with these measurements? How do we inform the community? How do we promote action? That is how, at the environment and the healthcare sectors, we have worked together. And the responsibility isn't solely on one or the other sector, but on both of them. Edison, tell us about your experience from your trench. Yeah, at the Secretariat of the Environment. So we've looked at policies that focus on citizen well-being. For example, we saw some mention of the forecasts. Well, forecasts have the purpose of helping people and helping them act. Because, yeah, a lot of the models can be useful for other things, like for determining policies in the medium or long term, which is how air quality works in many places around the world. But when we think about forecasts, that is because we want to give the people the information so that they can make their own decisions, or that so that healthcare decision makers can do something. So I think the main goal of forecasts is to help people. We should always keep this in mind, and we need to keep strengthening this. Just as people know that there are weather forecasts that tell them whether it's going to rain or not, what the temperature is going to be, well, the next step is, and the tools are there already, they're available, but people need to be aware of the air quality. Is it good? Is it bad? And why? We were talking about this yesterday, in fact. So I don't know elsewhere in the world, but here the weight of dealing with pollution is on the shoulders of the local authorities. And it's a much larger problem. But citizens, if they are informed, they could help us pressure other bodies, even at the national level, to take action. So the citizens need to be involved. There's no question about it. Thank you. So now that you mention it, and Dr. Patricia touched on this as well, I'm talking about the need to communicate. In the case of the Aburrá Valley of Medellin, you also use forecasts, you said. You also have a good relationship with the Secretariat of the Environment. So how have you faced this challenge? Yeah, you have a forecast, you have good data, there's actions that are being undertaken, and yet the population doesn't necessarily receive this information. So how do you face this challenge? How do you communicate health risks, right? And you have very powerful broadcasts. Right, well, thank you. It's great to learn from other cities. So you have to speak up, please, because we can't hear you. So in the case of our valley, there's 10 municipalities.
Una competencia en la cual pues, declara y tiene acuerdos metropolitanos, entre
So we
ellos
have
una
metropolitan agreements. We have the agreement 08, for example, which is a cooperation plan for promoting air quality. But this is a communication plan. It's before, during, and after a polluting event.
y el después de la controlización de calidad activan unas mesas, la cual tenemos involucrados gestión del riesgo,
So
secretarías de
this
salud.
has to do with risk management at each municipality. We developed an application which uses crossover methodology with some interesting variables. And we look at cases in that period, emergency cases, for example, for each of the individuals at the Aburrá Valley. We want to avoid a sensitive population to be exposed to bad air quality during these peak events. We also have citizenship tables or environmental roundtables with leaders who are aware of these data. So for the citizens to be able to use this application, we decided that people should be able to see what's going on at the station. So green is good, yellow, not so much, and orange, then, for the sensitive population, for the population at large, it can be a risk, right? So we have this color system. And then the citizens can say, oh, wow, this is red. This is so bad. We can't go outside. We can't be exposed. This has worked for us. 2018, 2019, we had over 7,000 events related to bad air quality. We had a study that I was talking about yesterday, but we need to keep generating data because this is a stream that needs to continue. So we need to figure out what the behavior is. Another thing that has been useful about this platform is to see the costs that are attributable to these deaths. Because these people contribute to the economy and then ended up dying. Thank you, this is a very valuable experience. One thing that we talked about, and as part of the practice community, as part of CanAIRy Alert, well, first we need to acknowledge that all cities need these kinds of tools. There's different strategies being carried out, but not all cities have the same level of, say, human resources, capabilities. Not all cities have experience with air quality programs. So, Margarita, for the case of Barranquilla, this is a relatively new program. It's been around for a few years. John said, right, why do I measure? Well, to inform the population and to take actions. And there's a series of tools also that can help decision makers such as yourselves, decision makers on the environment. But these tools are only getting started right now. So listening to these experiences, and I highlight this because in our practice community, we have cities who are at different levels of progress. But the big advantage is that when we hear about cases such as the Mexico City case, the Bogota case, the Aburrá case, these are ideas that other cities who are just starting can take advantage of. And they can move forward on this learning curve without having to wait 1 or 2 decades to make that progress. So Margarita, tell us about that. What is the status of collaboration between the healthcare sector and the environment in Barranquilla? And what do you think that you need from this collaboration or from civil society organizations to help cities such as Barranquilla, help them learn from the experience of other cities and help them make progress as fast as possible? Yes, at Barranquilla, this is a new network. We started in 2018 for a few years that we've been working on the air quality monitoring model. And our planning for the city has to do with planning for air quality for the city. And we have a healthcare program, environmental health. This has helped us have a better relationship with the healthcare secretariat. We need to strengthen that, of course, so that we can have access to data, to statistics. And we need to learn of cities such as Bogota, Medellin, and other cities. And this space is going to be very useful for us so that we can learn and we can know what to do. So, of course, there's the forecasting tools, there's spaces for collaboration, which are very helpful for cities who are just getting started in this process. This really helps us strengthen this these initiatives. So yes, we have planning, we have collaborate with the OPS in relation to evaluation, health, air quality monitoring. So it's been a first approach that we've had in that regard, but we still haven't reached that level of forecasting, of being able to tell the community what the associated risks are, which has to be our goal for the near term. But we are also planning in the long term. We need to collaborate, we need to participate in these spaces because this is very helpful. It can help us strengthen our programs and it can help us figure out what our path has to be for the future. Thank you very much. And then, listening to the experiences from Dr. Patricia Segura and based on what you have, what is a comment that you have in terms of these challenges? Being able to not just joining both sectors, but also being able to communicate that a lot of these actions, recommendations for non-exposure, for example, by Dr. Segura, if there's no exposure, there's no damage. So how do we prevent exposure? But not just for these peak events, these large events. How can we use these unfortunate peak pollution events, which is when people are sensitive? I mean, sensitive to the issue, right? But then after some time, priorities shift. So, what are some ideas that you have? What have you done so that while these peak events are taken into consideration, how do we keep people's attentions and people's concerns in other times, right? There's a lot of concerns. They're worried about the water, the air, everything else. So, do you have any ideas around this?
Yo creo que pues las alertas son en serio, o sea,
Uh, I
literal, hay
think
cánceres que uno literalmente, bueno, al mismo tiempo,
warning systems
ah,
can be useful.
como esos eventos como que son un foco de
We
interés
have
público,
these peak events
pero
that
creo
are
que en la
quite
divulgación como
relevant
tal de hacia
to
dónde
the
van las
public.
obras, qué es lo
But
que
if
quiere
we talk
la
about
alcaldía del
communication
área,
about the path that the
yo creo
city
que ese
is
es un trabajo
undertaking
más de
for improving its
políticas
air quality,
públicas,
I think that is a work
también
more related to
de
public
cuando las
policies.
personas interiorizan, digamos que la calidad del aire,
When people really understand air
como hay
quality,
muy buenos instrumentos comunicativos,
for
pero
example,
digamos que
Bogota has
falta la
very good
parte
communication
de la
instruments,
interiorización de esos pues,
but
buenos
people
instrumentos
need to
comunicativos
actually
por parte del
absorb
ciudadano.
these concepts, these ideas around
Yo
the
creo que
problems, how it affects
fortaleciendo
them.
eso,
So I think that by
con mucho más
strengthening this,
divulgación y
by
digamos que
communicating a
con los
lot more and
mecanismos
a
como
lot
tal,
better and by using all of these
pensaría que
mechanisms,
las personas
then I think
adoptarían más ese interés y
that
se estarían
people
abriendo más,
would be more
¿sí?
interested
Que
in
eso
the
es lo
topic
importante,
and
porque
they would
digamos,
start asking
cuando,
more from
cuando
us.
la ciudadanía muestra mucho más interés,
When
este orden
people
de gobierno
are a
a
lot
nivel
more
local
interested,
o incluso nacionales, empezar a
that means that
fortalecer
the local governments,
como
even
tal
national governments,
este,
need
la
to
parte
start
de
strengthening their
organización, parte
teams,
jurídica,
whether it's for
parte técnica,
monitoring, for management, for
también parte
forecasting,
de
for
las reglas
control,
es
because
controlar
part of air
también
quality management has to do with
a
controlling
nivel local.
these variables that can
Entonces,
affect local air quality.
yo sí pienso que
So
sigue siendo un problema
I think it's still a
de tratar de
problem
interiorizar al
of
ciudadano
helping people absorb
todo
this
lo que tiene que
information,
ver con el aire que respira, ¿sí? Más
everything
allá
related to the air that
de
they
la información
breathe,
que nosotros podamos generar.
of course.
Claro, yo creo que el problema ya está resuelto. O sea, el
I
diagnóstico
think the
ya
problem has
está
been
hecho.
solved already. We
Sabemos
have
que una
diagnostic
cuestión muy
tools.
sencilla de cómo yo describo el problema de contaminación del aire. Son emisiones
And the
al tema
quality program has to do with the emissions, right? How the atmosphere is transformed because of this,
emisiones, toda esa contaminación.
and
Entonces,
then
¿cómo
how
evitamos
that pollution reaches
disminuir
the
las
people.
emisiones?
So in that equation,
Porque
how
frente
do
a,
we
a
curb
las condiciones
emissions?
meteorológicas,
Because if we
podemos
look at the
hacer,
weather
hoy
conditions,
lo
we
mencionaba
can't do
Jason,
anything about that.
hacerle seguimiento y mirar
We
cómo
just need
podemos
to
controlar
track them and
de
monitoring and
alguna
try
otra
to
manera
forecast them
cortar esa meteorología.
for the
Lo que
future.
tenemos
But
que
that's it.
atacar son las
What we
fuentes de
do have to
emisiones.
tackle are the
¿Para qué?
emission
Pues para
sources.
evitar y
Why?
disminuir el riesgo.
So that we can
Ahí es donde tenemos que
reduce
empezar a
risks. That
fortalecer.
is where we have to
Bogotá
start.
tiene
We
un
need
plan
to
aire,
strengthen this.
plan aire 2030, y
Bogota has a
establecemos una
2030
serie
air
de
plan, which
proyectos
establishes a series
encaminados
of
a
projects
disminuir o reducir o hacer ese
that
disseminate
are aimed at
frente
curbing
al
or
tema de las
reducing
emisiones,
or
pero también
changing
estamos esperando
emissions.
que
But
la
it's also
comunidad se
important to
empodere. ¿A
understand
través de
that the
qué? De
community needs to be
gobernanza.
empowered. How?
¿Y qué es
Well,
la
through air
gobernanza?
quality governance.
Somos
What
todos.
is air quality
Y
governance?
eso quiero dejarlo siempre claro,
We
porque
need to be very clear
tiene que
about
estar en
that
la agenda
because
pública el tema de cuenta
this needs to be part of the
tiene
public
que
agenda.
hacer, tiene
Air
que
pollution needs
moverse,
to be there.
¿sí?
It needs to resonate.
Necesitamos tres
It
cosas
needs to move
claves
forward.
para que
We need
una persona, un ser
three
humano,
key things so that a person,
sobreviva.
a human being, can
Alimento,
survive: food,
vida y aire.
drink, and air.
Y en la calidad del aire que respiramos es la
And the
salud de
quality
las
of
personas
the
que
air that
estamos
we
ahí.
breathe will affect
Entonces, ahí es
people's
donde
health,
están
as we
esos
can
puntos
clearly see
que
by the evidence.
tenemos que atender.
So those are
Un poco así.
the points that we have to
Muchas
tackle.
gracias.
Thank you.
Bueno, yo pienso que tenemos que entender un poco
Margarita,
cómo la
okay, I think that
comunidad
we need
o
to
la gente
understand
aprende,
how the
cómo la
community
comunidad puede
learns,
llevar
how
a tener
people
en
learn.
realidad lo que se
How can
requiere
people
en
actually
nosotros.
learn
Nosotros generamos
what is
estas data,
required? Of
pero
course,
cómo
we
llegamos a
generate
las
data
personas para
models,
que eso sea parte
technical
de nuestro
information.
conocimiento. Las
But how can
políticas
the
son
community actually understand this
datos,
information,
sabemos
absorb it?
una
Yes, we
serie de
have
cosas.
risk information, we
Enseñar
have
a la comunidad
inventories, we
basado
know
en
what's
lo que
going
se
on, but we
conoce
need to
puede ser,
teach
por
the
ejemplo, ahora
community.
diciendo como en cambio climático se hacen mesas sectoriales por tipos de
Think about
economía,
climate
hacemos por
change,
todo, y
which
hacemos
with
la
where we
sección
have
de gestión
sectorial
del movimiento, pero que de la
roundtables or
realidad sea
discussions
distinto.
or
¿Cómo
tools
llegamos
for
con los
better
diferentes
understanding. We need to do
grupos?
the
¿Cómo
same thing
podemos
for air
hacerlo?
quality.
Hacerlo como por
How
grupos,
do we
porque no es lo
reach
mismo
different
hablarle a la
groups?
industria para
It's not the
bajar
same to talk to
emisiones
the
de
industry so
alguna
that they can
generación
reduce
que quiere,
emissions
que
and to
tiene
talk
que
to the
salir al
population
campo y quiere salir al campo.
because
Entonces,
people who
en
want to
ese
go
sentido,
outdoors, they want to go to the
creo
park and so on. So
debemos
in that sense,
entender y
I think
entender
we need
cómo
to
la,
know, we
la
need to
población
understand
puede captar esa
how
información que
the
nosotros usamos y
population
puede
can better understand and absorb this
sintetizar
information
información de calidad de aire
so that
para
they
que las
can take
personas
ownership
estén
of this information
representadas desde todos los sentidos,
and
desde la
then
primera al
take
tercero.
better decisions, right? But across all sectors,
Me
those who
parece
generate the
fantástico
emissions
porque
and the general
a lo
population.
mejor lo que también
I'm
deberíamos
glad
hacer
that
es
you mentioned
enfocarnos un poco
this.
más en
Perhaps we
este
should
gran trabajo que
also
se ha
take
hecho en los
advantage
últimos
of
años,
the work that has
porque
been
las
done
cosas
over many
empiezan,
years in
empiezan,
climate
como no son
change and
tan
how
lineales,
to raise
¿no?
awareness in people. But these
Porque no
topics are
podemos
not
aprovechar
separated.
cuando hablamos
They're
de
not
aire, hablamos
siloed.
también de los impactos de clima,
When
como
we
lo había
talk about
mencionado
the
antes
air, we can
acá,
also
de las
talk
condiciones
about climate
meteorológicas
change
y
impacts,
también ellos, ¿no?
about the
También nuestros
weather,
colegas de clima que vean
and
que hay una relación muy fuerte entre
vice
comparación
versa.
de
Our
estos temas.
colleagues who work
Esta
in
es una
climate
agenda en la
science,
que
they
estamos
should understand the clear
creo que
relationship
todos
with health.
envueltos. Nick, ¿cuál sería tu comentario?
Mick, what do you have to say about that?
Nosotros arbitrariamente, como les comenté ayer, tenemos una gobernanza de la calidad del aire que
We have air quality
es
governance
muy
right now.
entre ellas.
It's been very practical.
Tenemos unos autores voluntarios que pactamos con cada uno
We
de
have
las
volunteers.
y se los comunicamos porque en el esquema
We work in different sectors.
de la gobernanza que nosotros tenemos,
And in our
tenemos
governance
esos
scheme, we
partes
have
principales,
three main
transporte, ciudad,
stakeholders:
entre ellos
industry,
toma
transportation,
toma
citizens.
decisiones, donde está el ministerio y todas las entidades,
We have the
sectoriales
decision
públicas también
makers,
sectoriales.
all of the public
Los
bodies,
autores voluntarios, nosotros hemos generado unos indicadores de impacto, la cual
and
se
we have generated some impact
pequeñas
indicators
acciones
based on this work.
que el ciudadano toma
Small
acciones la
actions
cual
that people
me voy a
can
movilizar
make.
en un vehículo o me voy a
So
movilizar en metro, que
take a
efectivamente
person. Am I going to take the
baja el
subway
impacto
or I'm going to use a car,
de
right?
concentración. Tenemos un plan
Considering all of these decisions. We
efectivamente
have
a las
a plan
plan de movilidad
that applies to industries.
en la cual incentivamos a las empresas y les reconocemos
We incentivize
periodos de gestión
businesses
puedan
to
en el sistema de transporte masivo del Valle Aburrá.
for people in those industries to use public transportation.
Y
And these voluntary agreements, every time the period ends, this is published and we acknowledge all of the communities that participated through these small actions. Those people who need to go to work, well, they have to go to work, but if people can stay home, that's another choice that they can take. And we acknowledge these peoples when it comes to the accountability in our governance. On the other hand, there's citizen scientists, there's this whole network of people who help us determine how air quality is behaving in their communities. So this has worked great, also in terms of communication, so I think governance is essential. Thank you very much, Nick. And Dr. Luis Jorge Hernandez, Associated Professor of the Faculty of Medicine at the Los Andes University, has now joined us. Thank you very much. We have been talking about this interaction between experts in different fields, such as environment and healthcare, in terms of exposure to pollutants and the potential effects of that exposure. So, what has been your experience at the University of Los Andes in terms of raising awareness in the population and communicating the health risks to them? We mentioned how first it's important for experts in the environment and the healthcare sector can coordinate. We have good case studies about this, success cases in Bogota. Nick talked about the Aburrá Valley. Dr. Patricia Segura from Mexico City talked about their case where the National Institute of Respiratory Diseases used a index for vulnerable people, which is generated with health and environmental data to inform susceptible people. And they have actually validated the method. So we would like now to hear briefly from your experience. Thank you so much for the invitation by the air quality practice community, the community of practice. So thank you very much for this invitation. Could you speak a bit louder, please? Yes. Well, thank you. We work in air governance. We have our website, which we could show you, which is related to air governance. And it's great to be invited and to understand how, at the civil society level, we are working on air governance. Air governance has a lot of requirements. It's not just about the community being just informed, being told about this, being communicated. Air governance has to do with a way of co-management with the citizens and with its given progressive requirements. One requirement is for the citizenship to be part of the government spaces. If the citizens are not part of the governing spaces, there's no governance. What are these spaces? Like the local environmental councils, right, which looks at air, water, chemical substances. There's round tables at the regional level, like the region of Bogota, for example. If the citizenship, if the academic sector are part of these roundtables, then there is governance. It's not just participation, it's co-management, co-administration, which is very important. Sometimes, yes, you have the health secretariat, the environmental secretariat, the ministry, but there's no presence of the citizenship or the academic sector, which is required for governance. A second requirement for governance is transparency in the information. The information needs to be available, air quality information. It's usually not easy to access. Even for us, you go to the website and you have to click around, go here, there. It's so complicated to get the data. So access, open data is very important. Like in Bogota with the air monitoring network, but there's still some work to be done there. There's 25% coverage at the networks in Colombia, almost 75% in Chile, say. And the third requirement is that the citizenship should also comply with the air pollution plans. Not just the indicators of whether it's green or blue or, sorry, green or red, or whether they have to wear a mask, but they need to understand what the pollution plans are, the plans to fight pollution. Bogota, Cali, they all have information and they have plans to adapt to climate change as well, the different cities. But if in Bogota we look at, say, compliance for air quality plans, we can't find it if you want to find it. Medellin, there's no information about these plans to fight pollution. Curbing emissions, integrated comprehensive transportation systems. What is the information on compliance with this? It's not easy to find. A fourth requirement in terms of air governance is that there needs to be alerts and warnings established. Alerts and warnings for the citizenship, for the people, when the air quality levels are exceeded or they pass a certain threshold. In Chile, for example, things are going on when the air quality worsens. They close roads. Here, nothing happens. Yes, there's some information that is circulated by the healthcare authorities or the environmental authorities, but that's it. But the environmental alerts are generated by the environmental authorities, not by the health authorities in this case. That's part of the current governance, because when the environment generates it, that means that we've been at 24, 48 hours of exceeding these levels. So the healthcare sector has to be a lot more active on their side of air governance. The fifth requirement means that we need to be aware of the indicators. Citizen observatories. There's a network of observatories, of school observatories, measurements that of course don't have the same quality as the rest of the network, but they're still very important. It's still essential to have this network of citizen observatories for air quality. That is what air governance means for us. Everything else can be, yes, actions in terms of spreading information, raising awareness, and this is great. But governance is a well-defined, robust concept, and these requirements, these guidelines, are based on the World Bank. They have another important guideline, which is there needs to be a vision for 2030, 2040 of curbing emissions as much as possible. The European Union had it at zero fossil fuels by 2030. Now they moved it to 2040. Maybe it's not 2040 in the end, but we need that vision as a society. We need to keep this in mind so that we can continue the transition to zero fossil fuels. We need that. In Bogota, there's still some work to be done in this area, and this is basically what we mean by air quality governance. Thank you. Yes, you are outlining a challenge that a lot of cities are facing, right? And we need to listen to the decision makers or the environmental and air quality managers. Those are the people that we listen to. So that is, like Edison mentioned, when the citizens or the sectors that receive this information require this information, or they request it, or there's an exchange when they say, I need these data in this way. Well, there's a whole effort to do this, to make the data accessible. So this solution of air governance, that's one idea that we have. First, to establish this communication, and then see how the different areas interact. Who publishes the alerts based on which tools? And how do we communicate that there's a lack of certainty about the models and their precision, but we need to be looking at this. And who launches the alerts? Who takes action about the alerts? And I think this is a great idea. So, if there's any questions, Sandra, could we take them now, perhaps? Give voice to the people who are joining us online. Dr. Patricia has a question.
Sí, sí, sí.
Dr. Patricia, would you like to comment to what happened on the chat? Yes, yes, thank you. Jessica Tornell was asking about how these tools like the Mexico City app, right? How could that be expanded to other cities like Monterrey, for example? My comment is that the most basic thing is to actually measure the pollutants, to create reliable inventories, and then to communicate that to the population in a timely manner. And then when there are databases that have been established, then we can have predictive indexes so that we were saying we can provide information to the population not just when there's an emergency or there's a serious problem, but also just in general to empower them, to promote self-care culture so that the people can use these tools for their own benefit. I always say that when we want to go somewhere, at least in Mexico City, and there's a lot of traffic, we use apps like Waze or Google Maps to look at traffic data and to get there as fast as possible. Well, the same applies here. We need to understand what the quality of the air is like at the moment. Am I going to exercise outdoors? Or maybe I switch around my activities so that I can reduce my exposure and taking care of others like seniors or toddlers or very young children. And basically, in summary, we need to empower people and we need to promote this culture of self-care because the citizens are truly concerned about their well-being. They want to know what to do. They want to know how to improve their health. And this also means involving healthcare professionals so that they can issue these recommendations. Educators as well. In schools, it's very important to care for the children who are susceptible, as well as the population at large. They need to know how to use these tools for their benefit, these services provided by the government, by the secretariats, by the different bodies. Thank you. These apps are very important for informing the citizens. They exist. They exist in Medellin as well. If you look at the recommendations for Bogota, for example, they're there. Air governance cannot just be understood as something that is a responsibility of the citizens. Yes, they need to have recommendations so that they don't exercise outdoors during peak pollutant hours or maybe wearing their masks. They need to do that, but that's not enough because then we shoulder all of the burden on the citizens. And all the information should be available readily at the web without the citizens requesting it. And making this information available to citizens is also so that they can have their demands. They can follow up on that. And they can shoulder the whole of the responsibility. Yeah? Just like, oh, here are the recommendations, that's it. No. What is the government doing for improving air quality? What are the sectors doing? What happened with the transportation plans? What happened with the forest fires? This is an international phenomenon. So the citizens need to be able to make these demands. Governance means accountability. The government needs to be accountable. It's not just about providing guidelines to the citizens. It's a political thing. It's about demands. It's about empowering citizens. This is air governance. Of course. You mentioned empowering the citizens with this information, making reports accessible. Yesterday at the workshop, we heard about what the district secretariat in Bogota was doing. And there's a lot of work being done in the reports and how there's always a difficulty in reporting this information, but this is part of governance. The World Day of Blue Skies and Clean Air, September 7th, is coming up. We were lacking this kind of event, this kind of day, and this is also relevant to governance. Sandra, we are almost done, right? Yes, let's open up the room for questions from people joining us online. So, Jessica asked about the low-cost sensors and whether they are necessary for these apps when there's not enough data from other sources. This is a question by Jessica Tornell. Any comments about using low-cost sensors when there's lack of other data?
de Aburra. Efectivamente, en la aplicación Chiata tenemos una pestaña de estos sensores.
We have a tab in our app
Por
about these low-cost sensors. If you could speak up, please.
ciudadanos científicos, este programa que vincula a la ciudadanía,
We have a program at Aburra for the citizens. We have an app which includes a tab.
no son criterio para tomar decisiones, son
So these low-cost sensors are not enough criteria for making decisions. They're complementary. They are additional.
de la app. Yo creo que es un complemento.
But they can be helpful, so we have a tab for that. They can be,
Ayuda a que tomar
they can complement
de cierta manera tomar
all of the rest of the data for taking action, so they can be helpful.
Sí, en estos momentos tenemos 300 sensores de
We have 300 low-cost sensors at the moment
en bicicletas y
and 50 in bicycles
las concentraciones de
that we can use to measure the concentration of certain paths. Sorry, you need to speak up because we're broadcasting live right now and you need to increase your volume.
En el caso de Bogotá,
Okay, so for the case of Bogota, as we saw yesterday,
es igual, lo que pasa es Medellín es más que todo un mecanismo
the
para que la ciudadanía se empodere,
low-cost
por
sensors
las condiciones mismas de los
can be helpful,
sensores no se utilizan como para tomar decisiones.
but they cannot be used for making decisions.
Se hace siempre un proceso muy grande,
As we saw yesterday, there's always a very large process of validation
sumamente distantes a lo que tienen que dar.
so
Pero al final lo que nosotros
that we can have the results.
realmente es que pues
At the Secretariat of the Environment, what we say is that
digámoslo así, se me fue la palabra,
that
acreditados por el IDEA,
the
por
equipment that is validated needs to have, they need to meet certain criteria, certain rigor.
digamos que han sido comparados con ellos que tienen cierta fiabilidad
So we need a certain level of reliability from our instruments.
más adicional que es con el tema de los pronósticos, que es igual.
And if we think about forecasting, which is the main purpose of this session, by the way,
Con los criterios para
so the low-cost sensors do not meet the criteria to be used for forecasting. Sometimes because of their location,
al lado de una
people put them
responder
on their yards or next to the street
preguntas particulares que tiene la comunidad.
to answer particular specific questions that the community has about the air that they're breathing.
Ya, digamos que
But it doesn't necessarily scale. So they have limited uses, although they are useful.
puede ser
But if we include everything
uso si no hay
in an app, it can be a bit confusing if there's not enough explanation about the differences. Our colleagues in the cities of, say, Kampala, for example, and Cali as well, or Nairobi, they also have mixed or hybrid networks where they use low-cost sensors and reference stations. But what you mentioned, Edison, is that it depends on where I put the low-cost sensors. Their objective depends on that. So if the low-cost sensors have the right requirement in terms of being located in a certain place, if they're well calibrated and there's quality assurance, maybe they could be used for purposes of validation. But yeah, it's important to take this into account, right?
y a qué datos utilizamos. Y yo creo
What are
que
we
hay
exposed
unas
to
cuestiones
and
muy
what data do we
interesantes que
use?
en la comunidad de
Some
práctica hemos
very
podido
interesting
leer
experiences that at the community of practice people have shared
de estas ciudades en donde platican
based on the
dónde se
experiences of
puede
their own
hacer todo,
cities, right?
todo
Where
este
they
tipo de
talk about the
capacitación,
monitoring
pero
networks
sí
and
creo
how
que
they
a veces
need to be
tenemos
located
ese
and so on.
reto
But
de
yeah, we do
comunicar,
sometimes face these
de
kinds of challenges in
sintetizar
communicating
un dato
what it
generado por un
means.
equipo o
What do
incluso
the
de repente
data mean if
dependiendo
they
de
are
dónde están
generated by a
ubicados,
certain
porque
kind of
el
instrument or
nuevo
a reference
reto que
equipment
tenemos.
or
Antes
based
de
on their
la
location? So yeah,
maestría,
that's a
muchas gracias a
challenge.
Margarita. Margarita,
And I
ustedes
just wanted
están
to hear
en
from
este proceso de
Margarita.
crecimiento y justamente asociado a
You
a la
are
perspectiva
undergoing a
del centro
process
de
of
trabajo.
growth,
Lo que
right?
tiende a pasar
And
es
this
que
is
cuando
related to the low-cost
ayudamos los
sensors. What
bienestar,
tends to happen
cobertura,
is that when
presencia,
cities
pues
don't have
tienden a
such
traer sensores de
extensive
bajo costo, como el
coverage,
ejemplo también
they
de
use
rescate
low-cost sensors,
de ciudadanos
as in the
científicos,
example of
y
the
a lo mejor nos
citizen
puede comentar
scientist
también
network.
Arturo si nos puede
And
comentar qué
then,
están haciendo en el Museo
Doctor,
de los
if
Andes.
you could talk about what you're doing at the
Nosotros
Los
como
Andes
Susceptible
University after that.
con sensores de bajo costo,
We've done
hemos podido
exercises with
trabajar en
low-cost
equipo,
sensors
tanto con
together with the
tanto
academic sector,
aquí con la academia
but not as a
para
city.
calibrar sensores ajustados a Barranquilla
When
y
we
compararlo
calibrate
con
sensors
las
in
estaciones de
Barranquilla, for
referencia.
example, we compare it with the
Hay un
reference
proyecto allí de
stations.
algunos sensores de bajo
There is a
costo
project that involves some
asociados con tema
low-cost
del orden
sensors.
público y aprovechar allí para colocar algunos sensores en unos puntos.
So
El
yeah, we
proyecto
can
empezamos
place
aquí
sensors in
verificando
some
la
specific
correspondencia de
locations,
los
but we
datos,
have to verify how it works, how the
verificar
data
que
is
tengamos
managed.
la mejor,
The sensors that were
el
used
mejor comportamiento
didn't
de acuerdo a
have
todas las
the
condiciones del
best
proyecto de
results.
cierta verificación.
So we are undergoing a process of
Y pues ya
verification
para
at the
cerrar,
moment.
doctor, estamos ya por cerrar
And
nuestra
finally,
intervención.
we're almost
Bueno,
wrapping up.
los sensores de
So go
bajo
ahead.
costo pueden ser utilizados por el gobierno, pero pueden
Local
ser
sensors
utilizados
can
por
be used by the
academia,
government, but they can be
monitores
used by
caseros,
citizens.
¿sí? Lo que
These
tienen
are
ellos,
homemade
pues no
sensors,
tienen la
basically.
calidad, no es la calidad
But
que
of course,
ofrece
they
un ente
don't
de
have
seguridad ciudadana, debe ser
the
complementaria,
necessary
debe ser
quality for other
complementaria.
things. So they can be
Entonces,
complementary.
acá, por
They
ejemplo,
can
en
be used in
Bogotá,
addition to
estamos
other
trabajando,
instruments. In
bueno, aquí
Bogota,
la
for
página
example,
Sensores Ciudadanos de Bogotá,
this
es
is
la tarea de la
citizen
identificación de sensores
sensors
ciudadanos
or
y
citizen
trata también.
instruments in
Entonces
Bogota. We
muestra
have that
de
here
manera
available, which
clara
shows
cómo
the
estamos en
level
los
of air
PM10
quality.
y los PM2.5, no tienen la calidad,
PM10
la
and
sensibilidad
PM2.5
que tuvo
sometimes. They
por ejemplo
don't have the
Daniel
necessary
Bernal
quality, but
o
they help
Daniel
raise
Bernal, que
awareness.
se pone uno
There's
en
people
el,
like
bueno,
Daniel
en
Bernal, a
el
YouTuber, who
transmitiendo eso en
have
tiempo real,
this
cómo el
sensor,
proceso
they move around and they transmit in real
efectivamente
time,
se
they
maneja.
broadcast in
Cosa
real
que
time, and
en
this
otras
helps
partes
raise
estamos
awareness in
viendo
the
la
citizens.
calidad,
But we
efectivamente
need
se
the
observa
right
cómo es
information
la
about the
capacidad
quality
de
of these
medición, todo se
sensors,
hace
everything that it
no es
means.
malo, es bueno,
But this
pero
isn't
hay que
bad,
darle
this
una
is good.
parte educativa también.
It just needs to have
Sí,
some
creo que hay algo
education
muy, muy
around that.
válido y gracias, doctor Jorge, por la
I'd like
palabra,
to make another
porque
comment also.
el uso de sensores es acercar a la comunidad a la
The use of
medición, no es
sensors has to do
estigmatizar.
with
O sea,
bringing these
es
measurements
como
closer to
en
the
nuestra
community.
clase de biología cuando se les sacaban el microscopio. Ok.
It's
Y
like
luego
in biology class in school when you had the microscope and you could actually see the bacteria through
eso
the
acerca
instrument,
a la
right?
comunidad
Sensors are very
y
important
acerqué
because
las cosas.
this helps
Ahora
bring the
bien,
measurements
de eso,
closer
¿cómo
to the
vamos a
community.
contar con unos parámetros,
Now,
unos criterios ya
the question
establecidos
of whether
para
these
que ese dato
sensors
sea
meet the
confiable?
criteria
Ahí es
for
donde vamos
reliability in the
avanzando.
data,
Pero
well, we
el
do
uso
need
de
to
esos
make some
sensores
progress there. But yes,
principalmente
we
se
welcome the
utiliza
use
en
of these low-cost
estudios
sensors.
epidemiológicos,
They are
en
used in
acercamiento a la
epidemiological
población y eso
studies.
comparado con
We
temas
can
de
bring the
salud,
measurements
se han
closer to
venido
the community.
utilizando a lo
And
largo del tiempo.
they have
Ahora,
been
no
used
solamente
across
en esta
time.
medición,
Now,
aún no se
including these
descontinuó
measurements in a
esta
monitoring network,
legalidad, bueno,
which
un
is
avance bastante
allegedly or
importante.
ostensibly approved and validated, that's another
Sí, de
thing.
acuerdo, de acuerdo.
Yes. Thank you, everybody, for your participation. Dr. Beatriz will close the session. So we are now coming to the close of this last session for the community of practice. Okay, so to conclude, we managed to have an interaction between healthcare experts and environmental science experts, which is something that we always desire. We were able to hear from some successful experiences, cases where things are being achieved. Of course, we need to work more in the future. We understand that communicating the risk is not just about sharing the data or the risk to health. It needs education, but this will allow all kinds of experts in both sectors who want clean air to achieve the actions that sometimes can be unpopular, but changes that are necessary in our energy matrices, changes in some of the processes that have an economic cost, a social cost, but which are necessary if we want to curb these emissions and then have better air quality. Forecasts help us prevent, they help notify us when we're going to be facing certain conditions that are unfavorable. But these unfavorable conditions cannot be changed, but we can change our emissions, no doubt about that. So we need to notify people that there's going to be some bad days, but we need to notify them ideally less and less because there's less of them ideally. Of course, yes, temperature information, uh, when conditions are bad and they're going to be more frequent in some cases. So we need to double our efforts. We need to educate people. We need to work on our models, like our healthcare models, like the index for susceptible people, right? These are great initiatives. I'd like to thank everybody who was here with us. Sandra, thank you. Our panelists, thank you so much. And maybe we'll continue this chat later. Thank you, Beatriz, for this great closing. I'd like to thank the team, which is part of the community of practice. Thank you for helping us have these sessions. And I'd like to thank the experts. Here at Bogota, we are the offices of WRI Colombia. Thank you to the community of practice.